Hey everyone, welcome back to my channel. If you're new here, my name is Kayla and I am here to help you pass your NCCT and get you prepared if you're having a hard time or need a little bit of extra information and you want to review it before you take your test. I'm here to help you. So if you are also new here, I have been a phlebotomist for 14 years and I've been in the healthcare field for longer than that, and I have been a teacher for 7 of those years. I have worked in hospitals, outpatient, and I've done all kinds of different things. So if you watch the last 2 episodes, it kind of explains a little bit more of what I do, but that is just a brief interjection for what I do and what I've done, I should say, in my career. So I also have a series that I am recording that is me doing Get Ready With Me, and I am talking about my life experiences and what has led me to this point to where me being a phlebotomy instructor, this is where I've ended up. So anyway, we are going to be talking about, this is chapter 2. This is going to be this is chapter 2 for the complete textbook of phlebotomy, 4th edition. And I have a couple of different ways I'm going to give you guys this information, but I'm just going through the different places that I've taught at and what I know. So this is part of that. And so this is safety in phlebotomy, and this is episode 3 for chapter 2. And I'm going to be talking about now in this episode the types of category specific isolations. So those are the isolation is where we put our patients in a room by themselves where they have no contact with other patients and they are safe from spreading infection. So my last couple of videos, I talk about how standard precautions are a really big part of what we do as phlebotomists, and it is like our main priority in our jobs. So, so your first one is going to be the strict isolation. And this is a patient with a contagious disease such as chickenpox, diphtheria, or pneumonia, and is placed in a strict isolation. So this is one where they have reverse events where they're covered. You are protecting yourself from them, and you're not protecting them from you, if that makes sense. So you want to make sure you're fully covered, shoes, gloves, gown. Most likely you're going to be wearing N95 face mask, which those are fitted to you when you first get a position as a phlebotomist that completely seal around your mouth. You're also most likely going to be wearing eye covers. You're going to be wearing a hairnet for strict isolation. So it's very strict, and you have to clean yourself before you even leave the room, and then you clean yourself again. So it is very strict because those are highly contagious diseases, and we want to make sure that we're doing everything possible to prevent from spreading those from one patient to another, because we are going from every patient in the hospital to the next one, so we don't want to be spreading anything. So using those precautions are super important because we want to make sure that our patient stays safe and healthy. Your next one is going to be your contact isolation, and a disease that is transmitted by direct contact with the patient requires the patient to be placed in contact isolation. Scabies caused by infestation with mites is an example of the type of disease. It is transmitted primarily through direct contact with the infested patient. So if you are touching that patient, that is the way that the direct contact is going to be. That is a little bit less strict than your obviously strict isolation patient, but you're also going to be wearing a gown, you're going to be wearing a face mask, you're going to be wearing gloves, and that's pretty much it usually for that. For all of these jobs, so you want to make sure you're always wearing your hair in a ponytail because you don't want to be touching your hair or anything like that. You also don't want to be reapplying lip gloss or anything like that throughout the day while you're out on the floor. I definitely recommend doing that when you are back at your locker doing that, because you don't want to be spreading or catching anything in between that, okay? So that is direct contact isolation. Those are a little bit less easy to transmit, but those are also a way to help prevent them as well. The next one is your respiratory isolation. This is a patient with a disease transmitted through the air, such as mumps, pertussis, or rubella, may be placed in a respiratory isolation. Anyone who is susceptible to the infection must wear a mask upon entering the room. So for respiratory isolation, the #1 isolation technique is just wearing a mask. You don't necessarily have to wear a gown because that's not how that's transmitted. But for those patients, you're gonna see that all of the vents are completely covered up because we don't want to spread that throughout the hospital if they're in isolation like that. So really the most important thing that you're going to be wearing for a respiratory isolation patient is going to be your N95 mask. And so when you get those fitted, make sure that it fits you because they're very important and they are for your safety, I promise. So they will have the different types of sizes so that you know exactly which one to use and it won't be a problem. So, okay, so your tuberculosis isolation is the isolation of the patient with tuberculosis. The isolation techniques are similar to those with respiratory isolation. Tuberculosis is an opportunistic type of disease. It infects the individual's whole immune system. It infects the individual whose immune system has been weakened by some other disease process such as AIDS or simply old age. The isolation techniques are very similar to, like I said, how it's saying respiratory, but you're also going to be wearing gloves. You're going to wear gloves for every single patient, but these airborne isolations, you want to make sure that you're at least wearing the N95 mask. It is very important, and I promise you, you will regret it if you don't wear it or you don't have it on your face right. Your drainage and secretion precautions. These are sometimes called wound and skin precautions and are used for patients with open wounds. These are usually a result of abrasions, accidental skin cuts, surgery incisions, bed sores that have become infected. The fluid that oozes from a wound contains the infection. The dressings that have absorbed the fluid and any fluid touch provide potential for transmission of that infection to the healthcare associate or to another patient. So washing your hands before and after these patients, wearing gloves is super important. And a lot of times for these patients, you just want to make sure that you're only going in there to get your blood and coming out. You don't want to touch anything. So just make sure that you're wearing your gloves and washing your hands before and after. And I always recommend sanitizing after you wash them when you're finished, because that will help disinfect anything that wasn't washed off with soap and water. Okay, so your next patient is going to be enteric patients. Your enteric precautions are for patients with severe diarrhea due to a contagious bacteria such as Salmonella, Shigella. Okay, these types of infections are transmitted by contact with the infected patient's feces. So for these patients, I always recommend, and normally they're going to be the same as like your strict isolation. You're going to wear a gown, you're going to wear a mask, you're going to wear eye covers, you're going to wear your gloves, and most likely you're going to wear shoe covers, because you never know where any of that could go or if they're going to have something happen while you're in there. So those are isolation techniques that a lot of hospitals used, at least the one that I used to work at did, and it always was just to keep us safe. And so your next isolation, which is probably the most important one to keep in mind because every hospital does have a cancer unit, is going to be your reverse isolation, also known as protective isolation for that patient. So this is an isolation that has to do with you protecting yourself, protecting them from you. So normally patients that are on chemo are going to have a lower immunity, or patients that are really sick from certain diseases are going to have lower immunities, and anything that you bring in could objectify that. Okay, and so yeah, that's just to protect the patient. It's not to protect yourself from anything. So just remember, anything that says reverse isolation is you're protecting the patient, you're not protecting yourself necessarily. So just remember that. It's for their protection, not yours. These are all considered transmission-based precautions. The isolation guides were revised in 1996 to work with patients on 2 tiers of isolation. The first tier of standard precautions discussed earlier in this chapter, which are functional for a large number of patients who previously would have needed to be isolated. This prevents the costly isolation of patients. And the second tier of precautions, called as transmission-based precautions. It is intended for patients diagnosed or suspected of having specific transmittable diseases. So all of these are really for the patient and for your safety as well. Most of it is your safety, and then obviously not taking these infections to different transmitting them throughout the hospital, because that's you're very easily able to do that as a phlebotomist, because you are one of the people that goes from patient to patient to patient to patient, drawing blood or collecting different specimens and that sort of thing. So that's just something to be aware of when that happens. So OSHA is a lot of the reason why all of these are in place. So OSHA is an agency of the federal government that investigates the possibility of unsafe practices in the work environment. OSHA was the result of Occupational Safety Act of 1970. The goal of OSHA is to promote safety for healthcare workers and the environment. This is done by the following OSHA functions. Develop and promote health and safety standards for all occupations. Develop and issue regulations. Determine the level of compliance with health and safety regulations. And level fines for non-compliance with health and safety regulations. So OSHA plays a big part not only in the hospital setting, but they also play a big part in food and safety, not only for fast food, but restaurants, for grocery stores, for anything that you can imagine, even regular convenience stores such as CVS, Rite Aid, Walgreens, that sort of thing. They create all of these safety standards, and not only just like for health and safety, it's for the safety of like making sure they don't hurt their back or anything along the lines of that. So yeah, that's OSHA's the one that has made all of these things come to fruition, because before that, people didn't wear gloves, we didn't change needles, we literally were just willy-nilly all over the place. We weren't wearing masks. Literally, people used to smoke in hospitals. So anyway, that is it for part 3 for chapter 2 for this episode. I hope you guys found some valuable information, and I hope this is helping with your passing of the NCCT. And yeah, I hope you guys enjoyed. I will see you in the next episode. Have a great day. Bye.